Hi everyone, I'm Shivani Kalhan, a health coach and a diabetes expert at Besugarfit. Today we'll discuss about mental blocks to weight loss. Losing weight is not a straightforward task and can get disheartening when you don't see results, even after regular exercise and healthy eating. But did you know that food isn't just about nutrition? There's an entire psychology behind our everyday eating habits and research on psychology of weight loss, which has been around for many years now. There have been several studies conducted to get deeper insights on the extent to which our brain controls and impacts the ease and the amount of weight we can lose. We all know that constant struggle to restrict cravings and how hard it is to muster the willpower to refuse that one slice of pizza. So to lose weight, just changing our mindset and our habits is not enough. We also need to change our viewpoint. Behavioral psychology aims to understand why we behave the way we do and analyze patterns in our actions and behaviors. Using it to aid weight loss means understanding the many factors which influence weight gain, which can help us to make changes or prevent this from happening. Weight loss is an uphill battle for anyone, but those dealing with emotional struggles may have a harder time reaching their goal. The first step to a healthy resolution is identifying the issue. You may find that there is more than one roadblock to address. The good news is, however, that these hurdles are surmountable. Using psychological mechanism for weight loss, it is a concept that is already well established now. So the most 5 impactful psychological mechanisms that are normally used to induce weight loss are caloric expenditure, appetite, macronutrient selection, preserving lean body mass, preventing decline of resting metabolic rate. While it's true that the psychological mechanisms have proved to be very efficient in aiding the weight loss, it's actual doing of these mechanisms that determine the probability of you achieving it. There are 2 theories in behavioral psychology that define how behavior is connected to achieving our weight loss outcomes. The first is a social cognitive theory, based on the reciprocal relationship between person, environment, and behavior. It suggests that individuals receive reinforcement value from connecting their behaviors to valued outcomes. Second, the self-efficacy theory, continuation of the social cognitive theory, which suggests that confidence in completing behavior of interest will lead to accomplishing the behavior. Successful weight management is heavily dependent on healthy eating and exercise behavior. But when the primary goal is not only to lose our weight but sustain it in the long term, we may find that psychological mechanism as a stand-alone level may not get us the kind of results we want. This is where introducing psychosocial factors along with established psychological construct guarantees a successful outcome. According to Baker and Brownwell model, the relationship between physical activity, psychological effect, and psychological variables are interdependent and mutually beneficial. This trio has variables which helps to make the holistic encompassing process easy to achieve and even more easier to keep going on. There are 5 psychological variables which when improved has proved to be beneficial to this physical activity being done. Our mood, body image, self-esteem, self-efficacy, and coping. There are numerous barriers to weight loss, and each individual encounters situation and perceives the challenges they face differently. Barriers can be real or perceived both, of which are equally capable of hindering the achievement of weight loss. A. The apparent or real barriers. Real barriers can be physical or environmental. Physical barriers include poor health conditions, underlying medical and physical barriers like fatigue, discomfort, dehydration, and lack of sleep. Environmental barriers include having limited access to healthy food or exercise, facilitates poor social support or a lack of time due to social, family, and professional pressure situations. Second, that is the perceived barriers. Perceived barriers are those hurdles that are formed based on our own emotions. These are the thoughts and the feelings that can hold us back from losing weight. Identifying our emotional barriers to weight loss has been a big breakthrough in behavioral science and psychology. Some examples of perceived behaviors include negative association with physical activity, craving for comfort foods when sad, anxious, or stressed, which is also known as emotional eating, lack of awareness of obesity as a problem, high stress levels or depression, uninformed beliefs regarding heredity or generational body types, lethargy, and just a simple lack of motivation. So, the common mental and emotional roadblocks which are there to weight loss are: first, all or nothing thinking. This type of thinking refers to persistent, exaggerated thoughts that make us believe that we are either a complete success or a total failure based on any singular choices we may make. An all or nothing thinking style is most often related to a perceived lack of control over being disciplined or just simply following the routine. This could be about eating that extra plate of dessert or choosing to continue sleeping instead of going for the morning walk. All of us have experienced that time when we cheated on our diet and we felt so guilty for doing it that we decided to just give up rather than getting back on the track. Our assumption that even a slight misstep in control of a diet or a missed exercise session makes it a complete failure is the perceived mental block that we need to push through. B. The negative body image. Don't waste so much time thinking about how much you weigh. There is so more mind-numbing, boring, idiotic, self-destructive diversions from the fun of living. We live in a society that promotes physical beauty as symbol of success and perfection. All of us at some point have been critical or not too pleased with our own bodies or appearance and dreamt of being taller, slimmer, or curvier. In fact, having a negative body image is so common that scientists have a term for it, the normative discontent. Body image is our thoughts and feelings, the way we choose to see our body, how we treat it, our perception of its size and shape, and the behaviors we engage in or avoid because of it. So having a negative body image interferes and creates a mind-blocking making it difficult to lose weight. Now you may ask, but why is it important to have a positive body image? Isn't having a negative image more motivating if we want to make a change? No, it's not. In fact, it is impossible to motivate yourself or try to adopt healthy habits when you're constantly telling yourself that you look horrible and imperfect. A negative body image is also tied to self-worth, and that being a certain body shape or size is what makes one worthy. So all these preoccupations we have about weight and shape may lead to feeling of embarrassment in public or becoming self-unconscious and avoiding any sort of activity. Our thoughts impact our emotions and behaviors, and it is clear that feeling a strong dissatisfaction with our bodies will always stand in the way of reaching a healthy weight. Third is stress eating. It is no secret that how the term comes, comfort food has got its name. Because eating does make you feel good. But if you find yourself needing the distraction of comfort food, or you reach out to grab a fattening snack every time you are stressed or anxious, you are most probably stress eating. This means you may be eating when you're not hungry or without even thinking about it. We often don't even notice it, but not only do we eat more, hence we are anxious and our food choices also change, making us turn to foods that are very sugary or high in calories. If this wasn't enough, every time we are stressed, our body produces more of a hormone called cortisol that causes weight gain. D. Depression. Studies have shown that depression can not only make you gain weight but also prevent weight loss. Research also suggests that merely having the perception of being overweight can increase psychological distress and lead to depression. In addition to symptoms like insomnia and fatigue, making weight loss more difficult, some common prescribed antidepressants may cause weight gain, making you feel like you're stuck in an impossible situation with no way out. The core principle of using a psychological approach to weight loss is to identify faulty or unhelpful behaviors. The way of thinking, looking for patterns of unhelpful behavior, and learning better ways of coping with them. This is not only going to help you in relieving symptoms, but also makes a room for healthy habits and behaviors to show more effective weight loss results. Using a psychological approach also involves changing your thoughts, process, and thinking patterns, which in turn will eventually help to change behavioral patterns like overeating, sedentary life, reaction to stress, etc. Some strategies to change thinking and behavioral patterns are educate yourself and be more aware by reading, learning about weight loss and the various factors that contribute to obesity. Create small goals that are realistic, the SMART: specific, measurable, attainable, relevant, and time bound. Enroll into programs that can help you to modify your habits and behavior rather than one with just a food and exercise plan. Think positive and believe that change can happen. Understand that losing weight is not just a lifestyle change but also a mindset change. Don't look at exercising like a chore. Find ways to enjoy any sort of movement that can get your heart rate up. Use dark colored plates and bowls to create a drastic contrast between plate's color and the color of the meal, making the meal more obvious and larger in appearance. Smaller or portion controlled dinnerware can help in reducing the amount of food that is being eaten, making it appear that there is larger amount of food on it. Eating fiber-rich fruits and vegetables and drink a lot of water to make you feel fuller. Increase motivation and challenge negative thoughts by reading positive affirmations and keeping them handy on your phone to be read especially when struggling. Weight loss does not have any one-sided approach. It should be comprehensive and holistic, while taking the mind, body and spirit into account. While there are several barriers to weight loss, there are many facilitators as well that can help us develop healthy eating habits and exercise routine. By being positive about our self-body, perception, enhancing our self-confidence and embracing social support. Reach out to experts at Besugarfit to get a guided tour along with weight loss journey, ending in getting and keeping a prisky weight of successfully. Thank you.